Hello, everyone. I'm Taylor Alston Cleveland, and welcome to our Health Legacy series presented by the First Lady's Health Initiative, where we center real conversations around maternal health and community care. Today, we're diving deep into a specific yet common pregnancy complication that disproportionately affects Black mothers: preeclampsia. This episode is all about understanding preeclampsia and postpartum care. We want to empower you with the knowledge to recognize the signs, understand the risks, and advocate for proper care for yourself and your loved ones. So first up, we have Dr. Valencia Walker. Dr. Walker is a distinguished neonatologist, and she passionately champions the elimination of health inequities for pregnant people and their infants. She's a national leader of health equity, having previously served as the Associate Chief Diversity and Health Equity Officer for Nationwide Children's Hospital and holding key roles at The Ohio State University School of Medicine. Dr. Walker is also a proud graduate of Florida A&M University and earned her medical degree from Emory University School of Medicine. Adding to her profound expertise, she also holds a Master of Public Health and Health Policy at Harvard T.H. Chan School of Public Health. Thank you so much for joining us today, Dr. Walker.
It's a pleasure to be here. Thank you so much.
Next, we want to welcome Dr. Charis Chambers, also known as the Period Doctor. Dr. Chambers is a proud Spelman graduate and board-certified OBGYN. She earned her MD from the University of Alabama, Birmingham. Dr. Chambers is a passionate advocate for Black maternal health, bringing both professional expertise and personal experience to this conversation as a new mother. Her widely viewed online content continues to educate and empower her community of over 200,000 users online. Please welcome Dr. Charis Chambers.
Thank you for having me, Taylor.
Thank you for joining us. So we're ready to unpack a few nuances of preeclampsia and its connection to postpartum health. We're going to start with a few key statistics. First, preeclampsia affects at least 5 to 8% of all pregnancies, but its rate is an alarming 60% higher in Black women. Also, Black women are more likely to develop severe preeclampsia and may have higher rates of chronic diseases that are known risk factors for this condition. And lastly, when mothers leave the hospital, 36% of Black mothers experience hypertension. This figure isn't isolated. It actually aligns with the broader research indicating that Black Americans have the highest rate of high blood pressure in the United States. That was a lot to take in. So let's dive into this topic a little bit further. So I would love to start off with a question for actually both of you. How would you all define preeclampsia in your own words, both from your own personal experience, but also from your work experience as well?
Yeah, I guess I'll start. I think of preeclampsia as a systemic illness, meaning even though it's pregnancy associated, it really affects your entire body. We know that it can affect your brain and your lungs and your kidneys. It's not just one thing that looks one way. It's really a hypertensive disorder that gets very serious that can happen during pregnancy or after.
I think it's really important for people to understand that preeclampsia can happen after pregnancy as well. So I really appreciate you emphasizing that part because we tend to talk about it so much associated with pregnancy. I'm going to take a personal approach and start with preeclampsia is scary. It's scary for the people that are experiencing it. And I mean, someone who's pregnant, for their family members, because a lot of times we don't even have the right words to talk about it. It's also scary for us as the doctors that are trying to take care of them. In addition to that, it's definitely high blood pressure, but it's also just feeling terrible. It's your legs being swollen, your hands being swollen. I think those are some of the things that people probably tune into first and right away, even if they don't know all the words that go with it.
Couldn't agree more.
Thank you for sharing that. Why do you all think this is such an important topic for us to address in the Black community specifically?
I think because of the stats that you read. So if we have about a third of folks after pregnancy having elevated blood pressures, that means that risk is that much higher. I entered my pregnancy with the chronic illnesses that you mentioned that plague Black women more than other groups. I have kidney disease and elevated blood pressure. So I remember reading an article that said my risk for preeclampsia was like 98%. So in my journey, I just took it as a given. I took it as something that was an inevitability. And so I prepared my family in that way. When I get preeclampsia, when my blood pressure skyrockets, when I start to swell. And it was scary, even as a medical provider.
Wow. We often talk about how Black women are at higher risk of developing preeclampsia, but what are some of the factors, both medically as well as systemic, that contribute to this?
Yeah, I think first and foremost, we're talking a lot about hypertension, high blood pressure. That's definitely a medical concern that we have. But there are other things, just the amount of stress that we're under every day. You know, we are always trying to take care of everyone else.
Yes.
And sometimes we're forgetting to pay attention to the times when we're tired. It's also really hard sometimes to be heard. When you come in and saying, I have a headache, or you just need to sleep more, or you're saying like, you know, my joints hurt. Oh, you just need to lose weight. So that's another piece of it. It's so many factors kind of working in together. I'm sure there are more you can add.
Totally agree. I think the components that are the social components are really important. The lack of support that we have for birthing folks in this country, I think, contributes significantly. Certainly our desires to not be a burden, right? And to carry so much of that weight. My sister was diagnosed postpartum with preeclampsia. She was about 5 or 6 days after delivering twins. And she just felt weird. Like she just felt weird. It wasn't that it was a crazy headache. It wasn't like she had right upper quadrant pain or swollen ankles so much in like a weird way. She just felt off. And my older sister, who has no medical background, was like, check your blood pressure. And it was insanely high. And so, you know, sometimes it's not having that person there. If my sister hadn't been there, I don't know that my younger sister would have known to check it. I don't know that she would have had the support she needed to recognize it early.
And remember, there are so many things that are just happening either while you're pregnant, your body is just changing like all the time. You're like, okay, that was new.
Right.
But I think you're so right about having someone else to point it out, because even for us as like doctors, right? Sometimes you do still need someone to remind you, like, did you drink enough water today?
Yes.
So simple, but so important.
So, Dr. Chambers, as a practicing OBGYN, what are some of the signs that pregnant mothers and new mothers should be looking out for when it comes to preeclampsia?
So I think there's our typical signs, right? Really bad headache, even shortness of breath. That could be a sign of preeclampsia. Certainly excessive swelling. All of those things are kind of our typical signs of preeclampsia that we say, hey, look for this, or symptoms. Right upper quadrant pain, kind of in your right upper side, is a little bit concerning too. But there's also just not feeling well. And it's hard because, as we mentioned, postpartum or even late in pregnancy, you sometimes just don't feel well. You don't have the energy you once had. And sometimes you're like, am I just being a baby? Do I just need to push through? Or is this something wrong? And I know that we don't always feel like we have the agency to reach out when we're like, something's just off. Because sometimes it's just that, something's off.
Yeah.
And so all of those things.
I would also add, right, so part of my job as a neonatologist, I take care of babies. And more often than not, if a mama's not well, your baby's not going to be well. So I tend to see the worst of the worst, admittedly. So some of the other things that are very scary, if all of a sudden the way you are looking at things, blurry vision or things like that. Yes. So we talk about vision changes. The other things that you can, feeling like you're just so run down, so exhausted. I think that's another thing. Obviously, when it's really, really scary and really, really severe, you might start having seizures.
Really?
Yes. And that's where it moves from pre-eclampsia to what we call eclampsia.
Okay.
So whenever you're starting to get you feel like the way that you're interacting with people, your brain changes. Your brain actually changes.
Truly. It's like a cloudiness. But we can't tell people to look out for those signs and those symptoms if we're not going to hear them and believe them when they talk about it, right? And so that's the other side. We want to empower people to be advocates, but as care providers, we have to do our part too and say, I hear you. It's okay that you can't name this perfectly, but I believe you. Right.
That's a great segue into my next question, because it sounds like early detection is so key when it comes to this. And it's not just a critical issue or clinical issue. It is also a public health issue and
Absolutely.
a systemic issue. So I'd love to also hear your perspective on how can we address the systemic barriers that mothers face? What are some of the things that doctors can be doing to help kind of change this narrative?
Well, that's actually two different questions. And that's a lot to conquer. I think something that we're very passionate about and what we love about what the First Lady's Health Initiative is doing is educating people. Mm-hmm. And there are certain words, and I tell my friends this, like when they're talking about being pregnant and things like that, there are certain words that if you say those words, doctors should respond, right? So I start to kind of prep them with like I've been monitoring my blood pressure and my numbers are going higher than they used to be, which means, and you can buy, and get access to like those at-home blood pressure monitors, and it should just be a daily part of your routine.
Yeah.
I think that's really important. That's one thing to do, is really connect with your physician and show like, hey, I'm aware that this is a problem, so I need you to be tracking this with me.
Yeah.
Because if you're speaking up about it, that has to go into your medical record.
Mm-hmm.
Yes, absolutely. I actually gave my brother-in-law a talk track.
Really?
I said, this is what you're going to say. I was out of town when my sister was being taken to the ER. He was driving her. My other sister was watching the twins. I said, you are going to walk in and say, this is my wife. She just delivered twins 5 days ago. She has elevated blood pressures and these things, and I am concerned that she has preeclampsia. There's no way you are turned away. There's no way they lump you into the typical hypertensive protocol. There's a different way of dealing with elevated blood pressures as it relates to pregnancy.
Okay.
And so educating folks on how things are different, giving them the words to use. Some people can't advocate as effectively for themselves because they don't have the language. It's unfortunate that I have to give my brother-in-law specific language so that he can get the care he needs. But on the other side, I know what gets my attention.
Yes.
I know what I need to know to act and act quickly. Mm-hmm. So while it's important to recognize it early, it's also really important to advocate for those folks and give them the tools necessary to make sure that that can happen.
Yes.
And I would just add to that, so often, right, we talked about we're so used to being the one who takes care of everyone else, the one who makes sure everything gets done.
Yes.
When you feel sick and you feel bad, it's hard to speak up for yourself. So having someone else, and that person doesn't have to be like your husband or the dad or your best friend, but just one other person that can just say, she's not right, something's wrong, and continue to push to make sure, like, what are you going to do next? Mm-hmm. Have you thought about this? That those things, just don't be by yourself as much as possible. I know it's not always possible,
but that's big.
But it's really important. Don't go by yourself.
I told my family, there will be no moment in which I'm by myself in this hospital. Yeah. And I had an incredible doctor, an incredible care team, and I am an OBGYN.
Yes.
I said, don't you have me in this room
by myself
at any point. And that happened throughout my whole pregnancy and hospital course. I had someone with me.
Mm-hmm. That's such a great tip for our listeners.
Yeah.
And I would love to get the script that you gave your brother, because I'm sure a lot of people would appreciate that script. So Dr. Chambers, can you share some of the common misconceptions about preeclampsia that might lead to a late diagnosis?
I think the common misconceptions are related to believing that preeclampsia follows some set of rules or has to be ascribed to a certain person with a certain history. Okay. We know that preeclampsia has affected Olympians, affected international recording artists, affected the healthiest people who have had the most access to different providers and medications. And so it's not that it can't be you. And if you believe it can't be you, that sets you up to miss the signs. The other hugely important distinction is that although it is a pregnancy-related issue, that postpartum time period can be the most dangerous. That's when we see people, getting diagnosed super late because they were at home. They're overwhelmed. They're in the newborn trenches. And so they're not monitoring themselves. They're not being seen as often as they were during those last weeks of pregnancy. So for me, it is the preeclampsia has to happen in pregnancy, and it has to happen to someone who had more of those risk factors that I personally have, or someone that isn't quite me.
Got it. Is there anything you would add?
I think I would just add to that. We talked a lot about like the swelling, and everyone always says, "Oh my gosh, my feet swole so
Right.
much when I was pregnant,"
Right.
and just a lot of things that we think are inevitable with pregnancy,
Yes.
and not recognizing, no, this is not just regular pregnant.
Yes.
Something's really wrong.
That's so smart.
Yeah, and like
Yes.
the headaches, you're just like, oh, I had a bad day, or oh, I just needed to drink more water. Yes, you probably did need to drink more water. Being hydrated is very important. And it could be more.
It could be more. Yes.
That's so helpful. Now, Dr. Walker, just to stick with you, you work with Birthing the Magic to reach Black families. What are some culturally grounded strategies that you felt have been the most effective in educating and supporting families when it comes to preeclampsia?
This is going to sound like a plug, but honestly, it's us talking to us. That's something we feel really, really like it's absolutely necessary for us to do, is we need to connect people who look like me, who talk like me, who grew up in homes like mine, who have mamas like mine, to talk to each other. Because you understand things that other people don't know about. Not everybody's invited to the cookout, right? They try to, but not everyone's invited. So having conversations among each other is really important.
Yes. Yes. The safety of seeing someone who gets the unspoken, where you don't have to give all of this context for them to understand where you're coming from. That is such a major release for especially Black women, because we do carry so much. And so when I would walk into the room, and I see this regardless of age, and there was a Black woman in the room, when I walked in, they would do this because they were prepared to have to petition to be seen and to be valued and to be taken seriously. And just by seeing someone that looks like them walk in, they're saying, I believe this is different. Actually, I can get closer to the point. You get it.
Yeah.
And that matters.
It does matter.
It matters so much. Absolutely.
Just a follow-up question. When it comes to preeclampsia, because you mentioned your sister experienced it, what does postpartum care look like, or what should it look like if someone does have a diagnosis?
Absolutely. So once you get diagnosed with preeclampsia during your pregnancy or even postpartum, you are no longer following that normal, oh, I'll see you in 6 weeks type of timeline. You need to be seen more often. Oftentimes, that's with multiple providers, depending on how involved your preeclampsia course was. You may need to be seeing your OBGYN, of course. You may need to be seeing a cardiologist. You may need to be seeing an internal medicine physician. You may need to be seeing even a family doctor or whoever your primary care doctor is, so that you're creating a team that is going to support you beyond just this specific week timeline. As an OBGYN, I love, being able to be there for you and all the OBGYN partners. We love that, but you need long-term care.
Yes.
Preeclampsia increases your risk of developing long-term diseases later in life. And so we need your primary care doctor to know that. We need a cardiologist sometimes, or even a nephrologist, a doctor who looks at kidneys, to be able to monitor you until you're at a good place. And so it gives you more resources, but it is at that point you depart from general regular risk care and you need to be elevated to a higher acuity of care.
Okay, that's really helpful.
I think another thing to remember in this is that, of course, I'm the neonatologist. There's still a baby involved. I think one of the things that we haven't mentioned, and I'll just kind of insert that here, is that when your blood pressure is very high, when you're having complications with preeclampsia, it can affect how your baby develops as well. You're more likely to need me as a neonatologist and have a baby that ends up in the NICU because your baby may not grow as well. Your baby can be very, very small. And that can have an impact on the baby. I often say this so many times to mothers. They're like, I want to breastfeed. I want to do whatever. I was like, your body's not going to let you breastfeed until you are well. And so we have to prioritize your health. But then your baby still needs to be fed because we need your baby to grow. So recognizing that you need help from a heart doctor like a cardiologist, you might need help from a kidney doctor like a nephrologist, but you also need your pediatrician. You need your family doctor. We have to all work together to do what's best for you. And this is one of those times where you are the queen.
Yes.
Literally, you are the queen.
Yeah, you need a team.
Yep.
The team is I think the underlying thing. Of course, we talk about our village. That's an important part, but I'm talking about a credentialed, highly trained team that specializes in the care that you need. That's really important. So when I'm talking about a team for someone who has the diagnosis of preeclampsia, that means obviously you're a delivering provider, your OBGYN, possibly even your midwife or your doula, and certainly someone who is a general practitioner, someone who's like your primary care doctor who can care for you beyond the 6 weeks postpartum time period. You may also need on your team a cardiologist, that's a heart doctor, or a nephrologist, someone who specializes in the care of kidneys.
And then I would add to that team, remember, there's a baby involved. Yes. So it's really hard for your pediatrician to not know that you've been sick or that maybe you're going to be taking medications that might affect your breast milk supply or things of that nature. So remembering that the whole team is helping us take care of you, and then most importantly, helping you be the mother that you want to be to your newborn baby.
So Dr. Chambers, what are some of the ways that you've had your family support you during your pregnancy?
So, gosh, I mean, as an OBGYN, people kind of think, hey, you've got this figured out. But I told my family, I don't want to be the doctor in this situation. I want to be the mom. I want to be the new mom. I want to be able to participate in this just like anyone else. And so I need you. And that was hard to say, I actually need you. My husband, who is not in medicine, I said, I need you to look out for these signs. I need you to really pay attention if I have a headache. If I say something's blurry, if I have spots in my vision, if I start to look like I'm swelling too much, you notice a visible difference, you need to let me know. If you ever find me unconscious, take me to the hospital now. But I also let people know, my in-laws, I let my church family know. My church family prayed over me at least half a dozen times. Prayed over me, my baby, my health, knowing what I was going through and what health challenges I had. And I think that transparency and in community, especially in a faith community, it was so important. I would leave church after them laying hands and feel better than leaving the doctor's office because my faith is what's going to carry me through. I know medicine and I know the limitations of medicine, but I need to really dial into a God that doesn't have limits.
Yeah. And I would just add to that, like, in such a way, we talk about how our church family is our community. They are the people that love us and that take care of us. But there's so much wisdom in our church. There are people that have walked in faith. And sometimes you don't know a person's story until they start to talk to you. And there are our church mothers. There are our church grandmothers. There are so many people that often are in the healthcare profession that are attending your church. Yeah. You can reach out and touch someone and say, I'm a little scared.
Yes, yes. And they'll make sure you're not doing too much.
Yes, they will.
Right? They said, sit down. I was like, I was just going to help serve. No.
So it's a way to put faith and facts together to have something that's much more powerful.
Next, we're going to move to our tweetable wisdom segment where our wonderful speakers will give one piece of advice from their perspective. So the question that I have for you all is, what is one piece of advice that you would give to an expecting mother?
Okay, I am not the best at social media, so this is my attempt at a hashtag. So I would say hashtag baby ASA for my baby. And that sounds a little silly, but ASA is aspirin. And we've shown that a baby aspirin a day can really decrease the risk and severity of preeclampsia during pregnancy.
That's great.
I love
that.
How about you? For any expecting mother, I would want her to do, honestly, what I did. I asked my MFM two things. When should I worry? And then what? The when should I worry was so that I knew when I needed to reach out, when I needed to call, when I needed to come to the hospital. I needed to know what the threshold was so I could be empowered to actually make a change or make a move when I needed to. And then what was me really checking in to see, what is the plan? What is the plan for me? Am I being delivered that day? Do I need to be monitored? That helped me to manage my expectations. It helped me to get my husband on board and to prepare my village so that I didn't get overwhelmed or feel too scared. When should I worry? And then what? I think those are great questions to ask.
Those are great. Wow, that was such an amazing discussion. And we're just scratching the surface. We've truly unpacked the complexities of preeclampsia and its disproportionate impact on Black and minority mothers. But more importantly, we've gained vital knowledge about its early signs, effective management, and crucial prevention strategies to empower each of you to advocate for better care. I want to give a heartfelt thank you to our panelists today for this candid discussion, and to our community listening, we hope you feel more informed and empowered. Continue to be assertive and persistent in advocating for your own health needs. And to find more resources and ways to engage, visit us at firstladieshealth.com/maternal health. Also, help us amplify these voices by sharing this episode with someone who needs to hear it. And you can also connect with us by following us at First Ladies Health on Instagram. This podcast is partially funded through Patient-Centered Outcome Research Institute, also known as PCORI, Dissemination Award. The views, statements, and opinions presented in this podcast are solely the responsibility of the speakers and do not necessarily represent the views of PCORI. This is Taylor Alston Cleveland, reminding you to pull up a seat with us next time as we continue to center real conversations around maternal health and community care. Thank you.